I survived brain cancer, and I am a Canadian. I don't have a script, I don't have a cameraman, soundtrack, or fancy graphics. But please, if you listen to Shona Holmes, do me the favor and listen to my story. When my brain tumor moved and prevented fluid from draining off my brain, I would have died within days, possibly hours, if I hadn't got brain surgery. Unfortunately, in the province of Ontario, there were no neurosurgical recovery beds available. And it looked like we were going to have to fly to the United States, just like Ms. Holmes. But within an hour of being told that we wouldn't be able to stay in the city or even the province, a surgeon from a downtown hospital called and asked us to get in the car or ambulance or however we could get to his emergency department, and he would pull strings, call in favors, shuffle beds so that I could get my surgery. And I did, in less than 24 hours after I was diagnosed with adult medulloblastoma. And he was able to do that because he worked in a publicly funded healthcare system. He was able to exercise his excellent surgical skills and remove the tumor from my brain and hurry me into surgery because there was no one telling him that a 10-hour surgery wouldn't be profitable and that brain surgery is very rarely successful. But mine was. He got the entire tumor and I got out of the hospital 10 days later. But when it was time to plan my radiation treatments, I wasn't satisfied with the physician that I was referred to. So, 4 physicians and 3 hospitals later, I found one that I was happy with. And I didn't start my radiation treatment until I was perfectly satisfied with my physician, my clinic, and my treatment protocols. So, my advice to you as Americans looking at possibly a more socialized system of healthcare, please weigh your options carefully. Look around the world, compare social systems, and choose a system that values compassion, excellence, and universality over the profit. And by the way, I think my surgery and treatment cost the province about $90,000. It cost me about $5,000. So, not exactly free, but no one went bankrupt. And that's what I'd like to see for you. Thank you. Good night.